Okay, again, thank you for joining us for our webinar titled Checking In with Families in the Mother and Infant Home Visiting Program Evaluation, or MIHOPE, archive data from 2.5 and 3.5 year follow-ups. My name is Vrinda Mahishi, and I am a data project manager for the Child and Family Data Archive, also known as CF Data. We're joined by Kristen Fossetta at MDRC and Nancy Margie from the Office of Planning, Research, and Evaluation, or OPRE, within the Administration for Children and Families. This presentation today will cover an overview of MIHOPE and early childhood home visiting, data collected from MIHOPE Check-in, how to access the MIHOPE data, examples of using MIHOPE data across waves, and then finally we'll have an open forum for Q&A. We hope to have this presentation be interactive, so with folks asking questions and thinking about their own potential research questions. We will have time for this during the presentation, so please think about potential research questions as you're listening to earlier parts of this presentation. And now I am happy to pass the presentation over to Nancy.
Sorry, I was having trouble unmuting. Hi, I'm glad that everyone could join us today. My name is Nancy Margie, as Brenda said, and I'm one of the federal project officers for the MIHOPE project. As Brenda mentioned, we're going to start with an overview of early childhood home visiting and MIHOPE. Next slide, please. So while I imagine most of you are already familiar with home visiting, I'm going to provide a brief overview for those of you who may not be. Home visiting is a service delivery mechanism through which home visitors work one-on-one with families to provide a variety of family-focused services. Broadly speaking, early childhood home visiting programs aim to support the healthy development of infants and toddlers and work with families to help ensure their child and family well-being. Services are typically provided in the home, but could also be provided in another location set by the parent or nowadays virtually. There are many different home visiting models, each with different goals and designs, but generally speaking, home visiting consists of 3 types of activities. The first one is assessing family needs, specifically to identify family strengths, needs, concerns, and interests. Home visitors gather information from families through formal screenings and assessments and through informal means that include reading cues provided by family members and having conversations, building that relationship. The second kind of general aspect of home visiting programs are educating and supporting parents. Having identified family needs, home visitors devote most of their time to providing education and support to families. And finally, home visitors provide referrals and coordination because for some family needs, the home visitors may think that the family will benefit from receiving more specialized services that are available in their community. This aspect of home visiting highlights the place of home visiting as just one component in a comprehensive system of care for early childhood. So next on MIHOPE. While home visiting programs have been and continue to be supported through state and local governments and private foundations, federal funding of home visiting was greatly expanded in 2010 when the Affordable Care Act authorized the creation of the Maternal, Infant, and Early Childhood Home Visiting Program, otherwise known as MIHCV. This authorizing legislation also required an evaluation of the MIHCV program, and that evaluation has become MIHOPE. MIHOPE is sponsored by my office, the Office of Planning, Research, and Evaluation of the Administration for Children and Families, and we work very closely in collaboration with the Maternal and Child Health Bureau of the Health Resources and Services Administration. Both of our agencies are in the U.S. Department of Health and Human Services. MIHOPE is the first large multi-model national evaluation designed to test whether and how evidence-based early childhood home visiting improves outcomes for families and young children with low incomes. It included 4 national home visiting models, 12 states, and 88 local programs. to provide, and over 4,000 families. To provide reliable estimates of home visiting program effects, women who enrolled in the study were randomly assigned to a program group whose members could receive services from a MIHOPE-funded local home visiting program, or to a control group whose members received information about other appropriate services in the community. Data collection began around the time that families entered the study, and that's what we call baseline. When women enrolled in the study, they were had to be pregnant or had a child no more than 6 months old. And then we did a first follow-up point when the child was approximately 15 months old. And the baseline and 15-month follow-up data are already archived at ICPSR. And there's a webinar discussing details of the data available through details of those data available. And we can drop a link in the chat during the presentation. These data encompass many sources collected from a range of study participants, specifically mothers, caregivers, children, and home visiting staff, as well as many others too. That was what we did when the children were 15 months old. But then to ensure that MIHOPE was in a strong position to conduct later data collection with families, the MIHOPE team asked the families for updated contact information when the children were about 2.5 and 3.5 years old. And since the study was already reaching out to families, we also asked them to complete some brief surveys so that we could obtain some limited information about their family's current circumstances when the children were those ages. It's the data from these brief surveys that has been recently archived at ICPSR and what we're introducing today. We've also collected data on child and family outcomes, extensive data on child and family outcomes when the children were in kindergarten or first grade, and those data will be archived at ICPSR in the future. And then finally, looking ahead even farther, we are planning to collect administrative data when the children are in approximately 3rd grade, and we expect that those data will be archived as well. We'll come back to this later in the presentation, but all of the archived data can be linked by the study participant identifiers. So at this point, analysis can be done with data from study entry, the 15-month follow-up, the 2.5-year-old follow-up, and the 3.5-year-old follow-up. And we'll also introduce you to how to combine data across waves later in the presentation. And now I'll turn it over to Kristen.
Thanks, Nancy. Now we'll describe the 2.5 and 3.5 year check-in data that's just been added to the archive. So again, the primary purpose of the MIHOPE 2.5 and 3.5 year check-in data collection effort was to ensure that the study was in a strong position to conduct later data collection with families by asking families for updated contact information so they could be contacted in the future. Although the primary purpose of checking in was to obtain that updated contact information, families were also asked to complete 30-minute surveys that included a limited set of questions about 6 outcome areas. At the 2.5 year check-in point, the study team maintained contact with 70% of families, 51% of families responded to the survey, and contact information was confirmed for an additional 19% of families. At the 3.5 year check-in point, the study team maintained contact with 65% of families, 48% of families responded to the survey, and contact information was confirmed for an additional 17% of families. With the brief surveys, again, the study team could only measure a limited set of outcomes and could not comprehensively assess any of the domains specified in the MICV authorizing legislation. So of the 6 confirmatory outcomes examined at each time point, so 12 total outcomes, only 1 estimated effect was statistically significant, suggesting that home visiting did not have effects on these particular outcomes as measured through parent report. However, an analysis of all outcomes, both confirmatory and exploratory in each outcome area, maternal health, child health, family economic self-sufficiency, discipline practices and strategies, parental support for cognitive development, and child functioning, indicated positive effects in the areas of parental support for cognitive development and child functioning. So the check-in survey data includes outcomes in the 6 areas I just mentioned and that you see on the slide here. As you can see, most outcome areas were included in both the 2.5 and 3.5 year check-in surveys, but child functioning was only asked about in the second survey when children were 3.5 years old. In the next set of slides, I'll cover which specific outcomes were analyzed at these time points, either as confirmatory or exploratory outcomes, and are available in the archived data files from the 2.5 and 3.5 year time points, as well as from the earlier MIHOPE data collection that is already archived from study entry and the 15-month follow-up point. So we'll go area by area here. For the maternal health area, new birth after study entry, mothers exhibiting depressive symptoms, and mothers self-rating their general health status as poor or fair were asked at 2.5 and 3.5 years. All of those were measured at the 15-month follow-up point, and 2 of the 3 were measured at study entry. For child health outcomes, we asked caregivers at 2.5 and 3.5 years about the number of emergency department visits their child had for accidents or injuries, health insurance, and annual well-child visits, whether the child has a primary care provider, and whether the caregiver would rate the child's overall health as poor or fair. All of these outcomes were measured at the 15-month follow-up, and some were measured at study entry, though there are some differences in how the measures were constructed, and those details are available in the documentation that accompanies the data files. For outcome measures related to family economic self-sufficiency, the 2.5 and 3.5 year outcomes we analyzed were whether the mother was currently pursuing education or training, whether she had increased her education level since study entry, and whether she received public benefits in the last month, SNAP, disability insurance, TANF, or WIC. Most were measured at the 15-month follow-up, and all the public benefits measures were collected at study entry also. Okay, discipline practices and strategies. As noted here in the slide, the first 2 outcomes were measured using different parent-reported survey items at 15 months as compared to 2.5 and 3.5 years. So at 15 months, the conflict tactics scale parent-child version was used, but items from other mother-reported measures were used at the 2.5 and 3.5 year points. Okay, so we have a few slides to cover the outcomes in the parental support for cognitive development area. So on this first slide, focuses on home literacy. We looked at various measures of reading and literacy related activities at the 2.5 and 3.5 follow-up points, such as whether the parent reads to the child at least 3 times a week. At 15 months, this measure was based on 1 item from the infant toddler home, and at the check-in points, it was based on 1 survey item reported by mothers. The 3 other measures for home literacy were based on survey items reported by the mother at 2.5 and 3.5 years. Okay, the second slide for parental support for cognitive development outcomes shows the measures we asked about just at 2.5 years of age. These are related to storytelling and telling nursery rhymes or singing, as well as the frequency of doing specific activities when doing everyday things. Reading aloud, talking to or asking the child questions, and counting, singing, saying nursery rhymes, or using numbers. These weren't measured at earlier time points, as you can see. This next slide shows parental support for cognitive development outcomes that were measured when children were 3.5 years of age. Frequency of in-home learning activities in the past week, telling a story, teaching letters, words, or numbers, teaching songs or music, arts and crafts, physical activities, and playing board games or puzzles. Again, these were not measured at earlier time points. And as I said earlier, the child functioning outcomes were only measured at the 3.5-year follow-up point. In the domains of early academic skills, fine motor skills, and language expression, we measured whether the child can recognize all letters of the alphabet, write the letters of his or her first name, count to at least 20, use a pencil with a proper grip, and clearly explain things. For child functioning outcomes in the area of self-regulation, we looked at whether the child can sit still, is not easily distracted, can keep working at something until completed, and whether the child follows instructions to complete a simple task. So now I'll pass back to Brenda.
Kristen, next I'm going to go over some of the aspects of accessing MIHOPE's archive data. So the MIHOPE data is archived and available for access through the Child and Family Data Archive, or CF Data. CF Data is supported by a contract with OPRE and is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. We provide access to almost 400 data sets, some of which have the ability to be analyzed online. Users can search and compare variables across all data sets, as well as peruse publications that have cited studies archived at CF Data. We also have user support available to help you in finding and obtaining data. So there are several key requirements in place for accessing the restricted access files for MIHOPE through CF Data. So researchers must protect any sample member's information from deductive disclosure risk. They must not combine the restricted access data with any external data sources. And they can also not combine data from the MIHOPE and MIHOPE Strong Start restricted access files together. There are also videos available for MIHOPE, and these videos can only be viewed in the physical data enclave here in Ann Arbor, Michigan. The physical data enclave does not allow researchers to take information in or out. That would allow researchers to link the videos with information from other archive data sources. And all output that is taken out has to be vetted from our researchers here at ICPSR. Additionally, a few other requirements are in place to protect participant confidentiality. First, the principal investigator must have a PhD or other terminal degree, plus there are certain other requirements. Additionally, staff associated with programs participating in MIHOPE, which includes current or former home visitors, program managers, supervisors, national program staff, state agency staff, and other MIHOPE program staff must complete a supplemental agreement committing not to combine, merge, link, or in any other way interact their local program data with the restricted access files, i.e. the videos or quantitative data. These staff associated with programs participating in MIHOPE must indicate whether they have had personal familiarity with a study participant, that is, any mother, child, home visitor, or supervisor in the study. If staff associated with programs participating in MIHOPE do have personal familiarity with study participants, then they may not directly access the restricted access videos or quantitative data. But they may work with another researcher who does not have familiarity with a study participant who can then share the aggregate results. All of these requirements are in place in order to avoid the risk of re-identifying study participants. So now looking at how to access the MIHOPE study data, if you search for MIHOPE on the CF Data website, you will be directed to the study homepage as seen here. The homepage is where you will find important information such as a summary, and information on the study's methodology, sampling, weights, and more. The study homepage is also where users can search and compare variables under this tab and view publications based on the use of the MIHOPE data here under the Data-Related Publications tab. So a restricted data application is required for users to gain access to the restricted data. To begin your application, you would click on the Access Restricted Data button highlighted here, and then follow the instructions and complete the sections in the application portal, which I will go over in a little bit. But one thing I did want to highlight is that prior to applying for the data, we encourage users to download the documentation that is publicly available for each of the data sets under the Data and Documentation tab on the study homepage. So this will give you a good feel for the data and whether it is appropriate for your research needs. This list also shows all the data sets that can be accessed for MIHOPE as part of your application. And as you can see here at the bottom, the new data sets from the check-in data for both the 2.5 and 3.5 year follow-up can be found at the bottom of the list in data sets 16 through 18. So here we have a screenshot of the application portal. The application requires several pieces of information, including a description of the intended research project, an IRB letter, and a signed data use agreement. The data use agreement can be found under final signatures in the application portal, and it includes the supplemental agreements that I mentioned earlier regarding staff familiarity with MIHOPE programs and the physical data enclave application for the MIHOPE videos. Additionally, as part of the application process, users have to fill out a confidential data security plan as part of that packet as well. So archive staff are available to assist you with your application and to answer any questions that you may have along the way. Just email us at cfdata-help@umich.edu. I believe my colleague Tessa has put that information of the email address in the chat as well, so you can access it from there. And now I will pass it back to Kristen.
Thanks, Brenda. Let me just make sure I'm controlling the slides again. Here we go. Okay. Now we'll talk through an example to illustrate how to use the multiple waves of data that have been archived from MIHOPE. And again, please think about how you might be interested in using the archived data, and we'll have a time for question and answers in a few minutes. Okay, so to illustrate how you could use data from multiple follow-up points, we'll show you how you could answer the question, among program group mothers with depressive symptoms at study entry, what do their experiences with depressive symptoms look like over time? The mothers were asked about depressive symptoms at study entry and in each of the MIHOPE follow-up points to date, when the child was 15 months, 2.5 years old, and 3.5 years old. So we can identify mothers in the program group with depressive symptoms at study entry, merge data from multiple follow-up points, and then use the merge data to look at depressive symptoms through the time the child was 3.5 years old. So we'll walk through how to identify the data you need and merge it on the next slide. Okay, so for information about family analysis measures from study entry or the 15 months follow-up, I would recommend starting with the MIHOPE 15-month family analysis file documentation memo. So this memo describes analysis measures that were created by the study team and notes that mothers' depressive symptoms were measured through the baseline survey and the 15-month survey, and that they appear in the data file called MH_FAMAnalysis_RAF_DEID. The memo also indicates the relevant data file name, the variable names that are related to depressive symptoms at baseline and 15 months, and how those measures were created. So you'll see that depressive symptoms were measured with the CESD depression scale, and the relevant variable names are BL_CESD above for the baseline measure, and FM15AN_MHC_depressed sim for the 15-month follow-up measure. And the documentation memo also says that the research group variable, which indicates whether the family was assigned to the program group, is called T for treatment. And all of that is shown on the middle set of boxes in the slide here for the 15-month archive. Then, when considering variables from when the child was 2.5 and 3.5 years of age, I would recommend looking at the Check-in Family Analysis Files documentation memo as an initial resource to see if the study team already created an analysis measure that captures the information of interest. So again, for the 2.5 and 3.5 year follow-up points, you'll find in the documentation memo that mothers' depressive symptoms were measured at 2.5 and 3.5 years of age. So the data file to use is MH_check-in-analysis_RAF, and the relevant variables are shown in the box on the right, third from the top. We'll read through all of that. And the documentation memo also indicates that all 4 of the measures capturing depressive symptoms for mothers were measured in the same way. So the final step would be to merge the data from the 15-month family analysis file with the check-in analysis file using the common family identifier, which is RAF_family ID. And once you do that, you will have a new file that has all of those variables combined with the baseline and 15-month data, with the 2.5 and 3.5 year data. And with that, you would be able to look at depressive symptoms over time for program group mothers who had depressive symptoms at study entry. Right. So I will pass back to Brenda.
Thank you, Kristen. So now as we mentioned, we wanted to have open it up for an open forum for the Q&A. So please feel free to type in your questions into the Q&A box, or any of your responses to some of the questions that we have listed here into the chat. Additionally, if you would prefer to ask your question out loud, or to share your research question out loud, you can raise your hand, and one of our staff will be able to help unmute you so you can ask your question aloud. So one of the questions that we thought we would open up was, Chris, do you have any questions about using the archived MIHOPE data files? Additionally, we would like to hear from you about what analyses are you interested in doing with the MIHOPE data? And of course, feel free to type in any other questions and thoughts you have as well. Okay, I see a couple questions coming in, so let's take a look at that. See, a user has asked, what do I need to gain access to data from more than one MIHOPE follow-up time point? For example, the 15-month follow-up and the check-in follow-ups. So actually the process for applying for access to both of these will be the same in that you will follow the link to apply for access to the restricted data on the study homepage. And once you're in the application portal, when you go into the data selection section, you'll see all of the data sets listed that you can see on the study homepage, and you can actually check off which data sets you need for your research. So the 15-month data was included in the earlier release of the data, and then the additional 2.5 and 3.5 follow-up analysis is available as was newly released in December, and you'll see it on the bottom of the list, and you can check that off. Submit your application if you already had the data, and then we will follow up with you to get you that additional data. I think that actually kind of relates to the second question that I see that came in about what do I need to gain access to these new 2.5 and 3.5 year follow-up data sets if I already have access to the earlier MIHOPE data sets. So if you already have access, you do not have to reapply for the data. You would just be modifying your current existing application. You would go into your application in the portal, go to the data selection, and select these 3 new data sets, and then submit that application. Our staff will review your application and then follow up with you to make sure that you can gain access to those data sets. The next question I see says, was data collected on gender identity of parents, particularly mothers? Kristen or Nancy, if you wanted to.
Just trying to see what information we have on that. People entered the study many years ago at this point, so we may have posed, if we were asking questions in 2024, may have posed them differently than we would have more than a decade ago. But I would look at the documentation file for the baseline survey to confirm what is in there, and I can see if I can pull that up right now. But that's where that information might be. Nancy, do you have anything to add to that?
I was just going to add that I think most of the respondents over the years, my understanding, most of the respondents have been the mothers, but if we haven't been able to gather information from mothers, then sometimes it could be a father or another caregiver, whoever their primary caregiver is. But like Kristen said, when we originally started collecting these data, we weren't capturing things like gender identity in as nuanced a way as we would do it today. So I don't know that we have the detail that you might be interested in, but yeah, again, check out the documents online and see if it helps get you close to where you need to be.
Okay. Another question that came in is it possible to link the video data from the files to the dosage data to see if there were any correlations between how much home visiting a family received and how the home visits themselves are going? From the CF data standpoint, I don't believe that it is possible to link the videos with the quantitative data. I think because the videos are going to be viewed within the physical data enclave in kind of an isolated manner, that it is not designed to be linked with any of the quantitative data. But if Kristen or Nancy, if that sounds like there's anything to add.
No, that's my understanding as well. We were trying to be, with the video data in particular, since it could be easy to identify people because you could see them. My understanding is we had to keep them separate. But that's a great question.
As also a reminder, I think someone had asked if there was a link to go back and get this information that has been presented here. Yes, the recording will be available on the CF Data website, and we will be sending out an email to everyone who registered when that recording is available, and the slides will also be available at that time. Okay, another question that has come in. Where can I find the response rate for 2.5 and 3.5 year data for each national model?
I believe that information is included in the report on the check-in data. I'm not sure if we've shared the link to that report yet. In the chat, we can share that.
Yeah, I think if we can put that link into the chat when we have that, and also send it in the follow-up email that we send out when the recording is available. Okay, thanks, Nancy. I see that you added it to the chat. Okay, I don't see any other questions, but feel free if you'd like to ask aloud or type something in. In the meantime, I just wanted to remind you again to visit the CF Data website found here at childandfamilydataarchive.org to request access to these data and also to download the documentation and take a look at that. And then you can also sign up for our listserv while you're there to receive notifications on data release announcements, data webinars, and as well as our quarterly newsletter. So we will be sending out a notification to everyone who registered for this webinar today to let you know when the recording is uploaded along with the slides. And then, of course, feel free to contact us at cfdata-help@umich.edu if you have any additional questions that might come up. Oh, I see. Somebody has said, as always, thank you for providing us with this important information. So I like to echo that. Thank you, Kristen and Nancy, for providing all of this great information to all of us today. And thank you to everyone who joined as well. Oh, I see one more question has just come in. Which tools were used to collect data on the videos? HVOF or HOVRS or any other tools that look at the observation data?
Nancy, I don't know if you are remembering more quickly than I am, but that is not something that is at the front of my mind.
No, yeah, I don't remember exactly off the top of my head. Is that in the, do you know if that is in the data file, or is that something that would be found in the report?
I think I am less familiar with the videos, and so I don't want to misspeak, but we can get back with an answer to that. Will be in one of those places.
Yeah, or we can try, if people want to hold on, we can try to find it. Yeah.
Yeah,
Or
if you wanted to send that question over to the CF Data Help email as well, we can kind of redirect it to the MIHOPE team and try to get you that answer as well. Okay, I don't see any other questions coming in at the moment. So again, I just want to remind everyone, just feel free to email us with any questions that come up along the way, and we are more than happy to answer them for you. So again, thank you everyone for joining us today. I hope you have a very lovely rest of your afternoon. Thank you.